Another alternative is the Integrated Care Organisation. The right-wing think tank Policy Exchange, in a report published in November 2012, called for the creation of 10 full-scale ICOs in the NHS, which would each include primary, community and acute services into a single organisation. GPs will become its salaried employees. These organisations would each have a single budget to purchase and provide services. These could be run privately, and monitors suggested that they could also include private providers offering a range of services. These organisations will become the NHS equivalent of Kaiser Permanente, with the only difference being that they were supported by taxes rather than private health insurance. This is made clear by Nicholas Timmins, a former health correspondent for the Financial Times and a part-time Fellow of the King's Fund. Timmins declared that with this, patients would choose between competing ICOs, a choice, so to speak, between a set of NHS Kaiser Permanentes. Andrew Lansley's Health and Social Care Bill. The Health and Social Care Bill, introduced by Tory Health Secretary Andrew Lansley, has effectively abolished the core principles of the NHS. Its first clause repealed the statutory duty of the Secretary of State from the very time the NHS was founded to provide free, universal state medical provision. It was sold to the public as another attack on the restrictive bureaucracy, preventing doctors from doing their jobs properly and efficiently. Instead, the responsibility for the provision of care was to be placed onto the care commissioning groups, local authorities, healthcare providers, and then the public and ultimately patients. At the same time, the PCTs were abolished because of their statutory duty to provide equal care for equal need. This doesn't apply to the community care groups, which were set up to replace them and which are based on private insurance companies. The CCGs are supposed to be controlled by local GPs, but most are resolutely opposed to them. Apart from the fact that most doctors lack the time and energy to deal with questions of large-scale public management, they also did not want to be involved and blamed for having had to cut back and ration care. As a result, the CCGs are run through small, largely self-selecting management boards that may see no reason to consult other GPs in their area before taking a major decision. Thus, in 2012, the PCT in North West London took the step of closing 4 A&E departments and 1/4 of the number of beds for acute care without informing the vast majority of GPs. And even those who knew weren't asked their opinions on the measure. As well as removing the statutory requirement of the Secretary of State to provide health care and merely provide other services that would provide health care, the Act also included another clause which exempted the NHS from having to provide a number of services. Parliament, therefore, has no power to hold the Secretary of State to account for failure to provide health care. There is, however, still a commitment to provide a comprehensive service, certain discretionary powers and the ability to intervene in an emergency. But that's it. Lansley's Act effectively takes responsibility for commissioning and providing medical services away from the Secretary of State and gives it instead to private companies. As a result of the bill, new commissioning groups like the CCGs, responsible to the NHS Commissioning Board, which was renamed NHS England, are responsible for deciding who gets publicly funded care. This breaks the original requirement of the NHS to provide universal health care. The CCGs are required to provide care only for those who are enrolled with them, and not people generally in a particular area. Monitor, which supervises the system, is only responsible for looking after the interests of the people using healthcare providers. It is not responsible for the universal provision of healthcare. The bill does, however, provide that those patients whose treatment is too lengthy or complicated or just not sufficiently profitable for the CCGs and private healthcare companies are to be the responsibility of the local authority. The bill also excuses the Secretary of State from having to ensure that everyone has equal access to healthcare, nor do the CCGs have to provide it. Instead, there is a vague requirement to reduce inequalities in people using healthcare. There is also no requirement to provide services free of charge. The power to impose charges has been transferred from the Secretary of State to the CCGs, who are free to charge for NHS services. These have had the cap on the amount they can raise from private patients removed, so they can receive up to half their income from the treatment of private patients. Some of the most prestigious London specialist and teaching hospitals have thus started to raise additional money through the provision of private services for which fees are charged. Direct control over NHS provision has been abolished as the CCGs control the budgets and decide which services will be provided. And many of these are being run by private companies such as Virgin Care, Care UK and Chilvers McRae. Furthermore, the CCGs were also required by this year, 2016, to put out commissioning services to private tender by outsourcing companies, private consultants and accountancy firms such as McKinsey, Ernst & Young, PricewaterhouseCoopers and Capita. These can and do turn down patients who may not be profitable to the insurance company and its shareholders, like private healthcare providers do in America. The Referral Facilitation Centre in Hounslow, belonging to United Healthcare, is run by the British subsidiaries of US multinationals. These referral management centres are designed to reduce healthcare costs by cutting down on referrals to hospitals. Under this system, GPs' referral letters did not go to the desired hospital, but to the referral management centre, which would then try to make a decision to send them somewhere else if they thought it more appropriate. Those making the decision neither knew anything about either the doctor or his patient, and the system flatly contradicts the Tories' claims that they are supporting patient choice. Even when not run by these private companies, a significant portion of the GPs on their boards have financial links to private healthcare firms. A survey conducted by the GPs magazine Pulse in December 2012 found that 1/5 of GPs on them had such connections. Over a year later, in March 2013, that proportion had increased to 1/3. On the 1st April 2014, NHS trusts were abolished and became instead foundation trusts. These trusts can go into partnership with private firms as well as to form and invest in private companies. Regulations imposed on the new foundation trust by Monitor and the Care Quality Commission are mainly about commercial licensing and contracting. These supervisory bodies also have an obligation to make sure such regulations do not impose unnecessary burdens on the CCGs. Furthermore, such regulations and controls by the state may be challenged under the laws governing international commercial competition according to Chapter 2 of the Act. This includes EU legislation that states that once an enterprise is privatised, it cannot be renationalised. The Health and Social Care Act makes the following services the responsibility of the local authorities: immunisation, cancer and cardiovascular screening, mental health care, dental health, public health, sexual health services, drug and alcohol addiction, health protection services and emergency planning, and child health. The Act also states that charges can be made on some services. These are for pregnant and breastfeeding women, children's services, sickness prevention, the care and aftercare of the ill, ambulance services, the care of the mentally ill, dentistry, and sexual health. The removal of these services from NHS treatment and the charging of fees are only the latest development in a series of privatisations that saw the majority of dentists leave the NHS and the imposition of fees on eye tests under Margaret Thatcher. Yes.